World AIDS Day is the opportunity to learn more about and raise awareness about HIV/AIDS and remembering those who have died from the disease. Here from the City of St. Louis Department of Health are Public Health Program Representatives Whitney Anderson and John Murphy. Thank you both for being here.
Thank you for having us.
So we have an important day, International Day, coming up this Saturday, World AIDS Day, and there's events that the City of St. Louis, the Health Department, has planned for this Friday. But before we get into all the details of that, I think we should kind of take a step back and really look at some of the program and services that you actually provide that come across, that overlap in this area. So maybe get us started, so before we even get into Friday, we sort of know more broadly what the City of St. Louis and the Health Department's doing.
Sure. So John and I both serve as public health program representatives through the Department of Health, through their communicable disease section. So in our section, we're really focused on prevention and care of HIV and other STDs and communicable diseases. Really, we're focused on increasing awareness and knowledge and education while decreasing the prevalence of STDs, HIV, and just other communicable diseases, as well as doing that through working with our community partners.
So let's talk about that with the outreach, because knowledge, as they say, knowledge is power, and I think it's getting into the community, keeping it at the forefront, because a lot of times when you rely on sort of pop culture and the media and the trends, they go up and down, but the work still has to be done in the community. So let's talk about that outreach. What does that consist of?
Yeah, so it depends on, I guess, on kind of the population you want to serve, the location that you want to go to. We have a bunch of different programs that we work with. So for instance, Whitney and I work a lot with younger adults and youth. And so some of the things that we do is we go to college campuses and we have testing/presentation events. So we talk about just education on STDs, some things that you might not know, transmission of STDs, and just various things like that. There's another program that we do, one of our coworkers, same position, she works with the Beauty and Barbershop Initiative, so she goes to beauty and barbershops, has testing events there, just kind of conversations there, trains the individuals that are actually providing the beauticians and whatnot. They're actually talking to the community individuals about how to have conversations about HIV and correct information about HIV, so that things around stigma and incorrect information isn't being discussed. And so if something comes up in their conversation when they're cutting their hair, then they know how to talk correctly about it.
How do you think the public is receiving information? I mean, that's always really important in the work that you're doing, because you can have programs and services, but if they're not actually going into transition, transforming into change, I want to say, for people to get tested or their awareness to be raised. So what do you see on the receiving end from some of the groups that you said you work mainly with, reaching out to young people, but what's the response?
Absolutely. I think we've gotten a great response. I think it's been very positive. John mentioned that there is a lot of stigma. And so I think that John and I, as well as our other coworkers and our team in general and our communicable disease section, have done a great job at reaching some of the higher risk populations and individuals with high risk factors for some of these communicable diseases that we do talk about. Through the Beauty and Barbershop Initiative, through some of our other initiatives that we do, we have received great feedback. So I think it's going very well, and I think that as a team we're doing a very great job at kind of disseminating that really important information.
Do you think generationally, when I think back when I was in school, and I mean, it was a while back, I'm older than you, but just obviously, but in terms of the transfer of information again and the outreach, it seems similar, but I think the population is more aware. Is that what you're sort of saying? I mean, when you're talking to young people, do they already sort of know somebody or know something? I mean, do they feel like the awareness level is pretty high at this stage in St. Louis, or not so much?
I guess it would depend on kind of the populations that you're talking to. We've definitely seen a lot of correct knowledge on certain subjects, but there are some things that you might not just know a little bit about, like different ways of transmitting certain STDs, certain locations nearby that STDs can be, and some people just don't know about that. But I would say most of the time, I don't know, you can correct me if I'm wrong, I would say there's enough information to at least engage and have those conversations. And the general way it's received, I would say most people are very open to talking about it, because they either know a little bit, they don't know all, so they want to learn a little bit more, or they don't know too much, but they're very open to it.
Definitely. I think a lot of people, especially the younger population, they're very receptive. They want to learn more. They want to engage. I was just mentioning with John during one of our presentations, it seems like a lot of our younger population and other populations, they seem to already know quite a bit.
Right.
They just want to learn more. And so I think maybe social media plays a big part in that, but it's definitely helpful to be able to kind of guide that conversation.
Well, we're going to go to a quick break, but when we come back, we're going to talk about this event on Friday and how people can increase their awareness, if not get directly involved, if not physically involved at this event on Friday. So it's coming up. It's World AIDS Day is actually Saturday, December 1st, but prior to that on Friday, there's going to be a series of events that are going to take place, and we're going to get into that in our next segment. But don't go anywhere. We're going to have more right after this. Stay with us.